Thank you so much for everyone joining this evening for this wonderful presentation. We're so grateful to have everyone. I'd like to go ahead and introduce our presenters this evening. We are so fortunate to have Kelly Gingrich, a nurse educator, and Robin Fulham, also an oncology nurse educator, both on the prostate team at Bayer Healthcare Pharmaceuticals, and both bring decades and decades of experience in patient care. We are so lucky to have them talk to this community tonight. And all right, I'll go ahead and turn it over to you both.
All right, sounds great. Thank you so much, Lindsay, and good evening, everyone. I also want to say welcome to this PCC webinar hosted by Bayer Pharmaceuticals. As Lindsay stated, my name is Kelly Gingrich. I am a nurse practitioner by trade and one of Bayer's prostate cancer nurse educators as well. So Robin and I have the privilege this evening to present Getting Started with Xofigo, your introductory guide to treatment. In today's presentation, I just want to let you know we'll be on label per the prescribing information. We are happy to answer any questions, and please feel free to enter your questions in our Q&A chat box. We will hold all the questions until the end of today's presentation, and we'll allow plenty of time at that point to answer those questions. Despite our professional backgrounds, Robin and I will be unable to answer, unfortunately, any treatment-related questions. If a question is asked under that particular category, we will have to defer you back to your healthcare providers at that point in time. Our hope is that you'll be able to take away a few new pearls of information from tonight's educational presentation. Robin and I do feel absolutely honored at the opportunity to speak with you all tonight. We truly admire your strength, your courage, your fight, and your willingness to be strong advocates for yourselves and for others. And without further ado, we'll kind of jump into the material. So just as I stated, we're going to be speaking about Xofigo this evening, and that's how it's pronounced. I know it sounds like an interesting word. The other name is radium-223 dichloride. And so Xofigo is used to treat prostate cancer that no longer responds to hormonal or surgical treatment that lowers testosterone. It's for men whose prostate cancer is spread to the bone with symptoms, but not to other parts of the body. So there's no visceral spread or metastasis to other organs. Now, we are going to have some important safety information throughout the presentation as well. And on this first slide here, what we do want to touch on is that it is not known if Xofigo can be safe and effective in women, and it can harm unborn babies when given to pregnant women. So really the educational point is to use contraception throughout the course of the treatment, as well for as at least 6 months after the completion of the treatment as well. And I'm not trying to skip over the clinical trial. We are going to be talking about that a little bit more in depth. We did gain our FDA approval back in 2013 with the Xofigo trial, and I'll be touching on that at a little bit of a later date. But the important thing is that our primary outcome of the Xofigo trial was about overall survival, and that Xofigo can help extend life by more than 30%. So some of our program objectives tonight and what we are going to be talking about with you all is that we're going to be looking at and understanding what happens when prostate cancer spreads to the bone, which is some background information. We're going to explain how you and your doctor can monitor your disease, how to recognize different signs and symptoms of metastatic castration-resistant prostate cancer, or its shortened form of mCRPC. We're going to describe how Xofigo works. We're going to highlight some of the key benefits of Xofigo. We're going to look at the safety profile and some potential side effects of this Xofigo as well. We are also going to review what patients and their loved ones should know before, during, and after treatment with Xofigo. And then also some of the financial support options that are available, and learning the importance of staying informed about mCRPC and different treatment options. Now, before we move forward, we just want to note that this presentation is being delivered on behalf of Bayer and does comply with all applicable FDA regulations. So let's start out with what you should know when prostate cancer spreads to the bone. So with prostate cancer, we understand that it is a hormone-sensitive cancer that tends to feed off of the main male hormone of testosterone. So initially, after progression through standard of care therapies, oftentimes we enter into the hormone therapy space where we're lowering those testosterone levels down to try to remove that fuel to the fire. Now, eventually the disease, unfortunately, can progress throughout those hormonal therapy treatments. And then we start to look at other options with different mechanisms of actions or basically different treatment options that work differently to try to treat the prostate cancer, really throw that cancer a curveball at that point in time. Now, prostate cancer, like other cancers, has the affinity to move different parts of the body or metastasize. And the two most common spots of metastasis or spread for prostate cancer is number one is to the bone. And the second spot is the lymph nodes. And so we're going to be talking a little bit more about the importance of prostate cancer when it spreads to the bone and some background. And it will play really nicely into our conversation then about Xofigo. So when prostate cancer spreads to the bone, so there are thousands of men who are fighting prostate cancer that has spread to the bone or has metastasized to the bone. In fact, and so please know that you're not alone. And in fact, there are 9 out of 10 men with metastatic castration-resistant prostate cancer. That's 90% when the disease becomes metastatic, will end up spreading to the bone. And so there's a lot of gentlemen that we can help with different treatment options that target actually the spread to the bone, such as Xofigo. So your healthcare provider may have told you that your prostate cancer is no longer responding to therapies aimed at lowering testosterone. So these are some of those hormone therapy agents that we were talking about. And at that point in time, the prostate cancer ends up falling into this category of metastatic castration-resistant prostate cancer. So let's break that down a little bit. Metastatic means that it's spread to another part of the body. Castration resistant, it means that despite lowering those levels of testosterone really to undetectable levels, we still see a PSA rise despite that, and then prostate cancer. So we're going to further talk about what we can do to monitor the disease as well. So if your doctor suspects prostate cancer has spread to your bones, tests such as bone scans and other imaging, prostate-specific antigen tests, which I'm sure all of you guys are very familiar with, because we typically use this as the tumor marker for prostate cancer. It does stand for prostate-specific antigen. I oftentimes sometimes laugh because myself as a provider, I oftentimes deem it provider-specific anxiety, or it can often cause some patient-specific anxiety as well. Because if we see that number going up, we oftentimes correlate it with the activity of the prostate cancer. Or a blood test to check alkaline phosphatase levels or ALP levels should be considered. So just different things that can be considered to monitor the disease. Now, alkaline phosphatase, this may be a new little piece of information for you all, so we'll go through that. And this really comes into play actually later on in the disease course as we start to see some progression happening, in particular whenever when the prostate cancer metastasizes to the bone. So with PSA tests in metastatic castration-resistant prostate cancer, PSA tests alone should not be used to determine long-term outcomes. In fact, alkaline phosphatase levels or ALP tests are more suited to show bone breakdown and how MCRPC can affect you over time. For an alkaline phosphatase test, it's important to ask if a bone scan or checking the ALP levels should be considered. And so ALK-phos, you may be asking, what is it? So it can be, ALK-phos is a substance that may be released into the bloodstream when bones break down. High levels of ALK-phos can give your doctor a better idea if your disease has spread to the bone. And I'll let Robin chime in here as well, but even basically with monitoring, it's important, but also in terms of Xofigo, I will say, since it is, and we're going to be talking about how Xofigo works, it's going to have a different mechanism of action. It's not going after those androgen receptors like you may be used to with some of the hormonal therapy agents. And so I will say oftentimes how I would educate my patients as well, is saying we're going to be taking a PSA vacation. We're going to be we can still look at that number, but please know that the value of that number, as important as we deem it to be, while you're on Xofigo, it may go up, it may stay the same, or it may go down. And so that's not going to correlate with how well you're doing with the treatment. Now, the alkaline phosphatase test, I will say, is a better indicator for us. And we actually have some data that correlates with that. So with the ALK-phos test, oftentimes along with PSA, we can get that at baseline prior to starting Xofigo and with each subsequent treatment. And what we can see with the ALK-phos is that we can sometimes see more of a downward trend whenever the bone mets are being treated. And so, Robin, would you like to add anything in there in that conversation? I know that's one that you and I, that we have all the time with our accounts as well as with patients in clinic. And so is there anything you would like to add?
No, that's really good. That's just the key thing is, you've been so used to trying to understand where your PSA level is, and just to feel comfortable that it's going to be either tested or used in a different way while you're on Xofigo, is just know that that's okay. So, because Xofigo does not affect the androgens, and so your PSA levels won't be something that you have to worry too much about during the Xofigo treatment. And then the ALP is such a good level to kind of even monitor. It gives us a good idea of what's happening within the bone disease, because it is tied to some of the cells that build bone. And so that high level kind of gives us a really good indication of really where your course of disease is long term.
Absolutely. And I always think of Xofigo, and we're going to be talking, we're going to be diving right in here and moving forward. And Robin's going to be taking the wheel here in just a minute. I look at it more as a systemic treatment. So, and we're going to be talking about the clinical trial, but the gentleman on the clinical trial needed to have greater than or equal to 2 bone metastases to be eligible for the treatment. And instead of kind of pacing your tail, if you will, if you have one spot in the bone that may be causing pain, discomfort, or symptoms in general, and treating that, and then by the time you're done with radiation therapy to that particular site, another spot is acting up. You can do the systemic treatment, and then and we hope that that will help to make people not only feel better, but decrease the overall bone burden. But in general, if there is a spot that would happen to act up, you can still get external beam radiation therapy while you're getting Xofigo. So I think that that's important to note, that this is a systemic therapy. It's something to help to treat all the bone mets. So Robin, let me pass it. Oh, I'm sorry, I have one more to go here. We're going to talk about how to recognize some symptoms. And so when prostate cancer spreads, you may experience symptoms such as exhaustion, feeling tired, difficulty moving or bending, problems with posture, general pain or discomfort in the lower back. And I will say pain is something that people do associate more so with bone metastasis, but it can definitely come in all different forms. Difficulty doing everyday tasks and problem sleeping. Now, be very open and honest with your providers. I know I can speak for Robin and myself. Whenever it is good to let your providers know how you're feeling, let your caregivers help to kind of shed some light as well on what's going on at home, if you're okay with that. And you really get to know your provider as well. You're in there pretty frequently getting lab work done and going through treatments and talking to them. And in the midst of kind of having those important treatment discussions, you're also having discussions about what you enjoy doing. And so say you're an avid golfer and you're golfing 18 holes on the regular, but then you may now only be doing 9 and you're not really sure why. It's important for the doctor to really understand that it may seem something that's not as important to you. It may be a red flag as to something else going on. And I mean, this could pertain, we're using golf as an example, but it could be, I mean, pickleball is a really exciting new thing that I guess a lot of people are getting into. So if you're not playing as much pickleball as what you were, or tennis, or walking, or hiking like you used to, these are things that are little red flags that can go up. So be sure you just talk to your doctor about any symptoms that you're experiencing, any decreases in your activities, or what you enjoy doing as well. So Robin, now over to you.
Okay, great. So now we're going to talk about the treatment of Xofigo, and that this is another type of treatment for your metastatic castrate-resistant prostate cancer that's spread to the bones, but not to other parts of the body. And now that the bone mets is causing some symptoms, and so this is the time to really start thinking about whether Xofigo might be an option or not. And you can go to the next one, Kelly. So how does it work? It's very unique. We've talked about it being radium-223. So for you chemistry buffs or nuclear physicists on the side, it kind of, you think about Madame Curie and all of her research around radium. This is really what we're talking about. And the way it works is it mimics calcium because it's related to it in the periodic table. And so it's going to go to the areas where the bone is, just like calcium does. And because the bone mets are an area where the tissues are growing rapidly, that's why that radium will go to that area. And it gives off a strong amount of energy. And but it gives out this really large amount of energy in a very short space, so it doesn't travel very far. So it limits the amount of damage that the healthy cells that are around it will experience. It can be absorbed by other organs, your bone marrow and your digestive system. So when we think about some of the safety pieces, which we'll talk about in a minute, that might be where you see some of the side effects if you are going to be receiving Xofigo. And we talked about it being radioactive, but it will not make you radioactive. So this is one of those radiation particles that you can receive and still hug your family members and be out in public. And it's not something that will keep you isolated, but it will. It just goes to the area of the bone and it can kill those tumor cells that are in the bone. And so it's really kind of a unique mechanism of how it works, which is different from how chemotherapy works and different from all of the androgens you would have been taking already at this point. So it's very interesting how that works. You can go to the next one, Kelly. So at the beginning, Kelly talked about how life can be longer with Xofigo, and the benefits of that is that it can extend life by more than 30%. And so there was a clinical trial that was done with 921 men with metastatic castrate-resistant prostate cancer, and some received Xofigo on the clinical trial, and some men on the other arm just received what was the best supportive care at the time, and that did not contain Xofigo. And there was an increase in overall survival of 14.9 months versus 11.3 months. And so that can extend life by more than 30%. And so we're looking at somebody who has metastatic disease and being able to offer them something that has some overall survival long-term, it really provides another option for patients. Wouldn't you agree, Kelly?
Oh, absolutely. And I always like to say here, like, I mean, this is the median or the average was about 3.6 months is the difference. And so that there are some men that it helped for a longer period of time and vice versa. With that being said, in oncology, there are a lot of different products with different overall survival benefits. And if you can add all those survival benefits together, that's really where you get kind of the amazing results from. And so 3.6 months, I mean, to some, you may be saying, well, that doesn't seem a lot, but I always say that's a birthday, that's an anniversary, that's a wedding, big events. I mean, these are important goals in life that we want to try to be able to get to. So you can see the significance there. All right, back to you, Robin.
So Kelly mentioned earlier when she talked about some safety at the very beginning of the presentation that it's unknown if Xofigo is safe and effective in women, and that Xofigo can harm unborn babies when given to pregnant women. So it'll be really important to make sure that men should use condoms and make sure that female partners who can become pregnant that use birth control or some other contraception during treatment and for 6 months after the completion of Xofigo. So that would be about a year of time where that would be necessary. And there are some other things to make sure that your healthcare provider is aware of, particularly if you've had a history of bone marrow problems. Because Xofigo can cause your blood counts to go down, including your red blood cells and your white blood cells and your platelets. And your red blood cells carry the hemoglobin. It gives you a lot of energy, and your white blood cells are there for infection fighting, and your platelets keep you from bleeding. You know, when you cut yourself and the blood stops, that's your platelets. And in the clinical trial, there were some patients who had to permanently discontinue therapy because of bone marrow problems. So that's another reason why you would have that conversation with your provider if you have any history of that. And in addition, there were some deaths and blood transfusions that occurred due to severe bone marrow problems. And so your healthcare provider, because of that, will do blood testing before each dose of Xofigo and during the treatment and then following as well. Make sure you tell them if you are receiving any chemotherapy or any types of extensive radiation therapy, because you wouldn't want to get those done concurrently, except for if you were being referred for external beam radiation for some pain, that would be different. And if you've been taking Zytiga, which is also known as abiraterone, and that drug is given with prednisone or prednisolone, and that can increase the risk of fractures and death. That was from a clinical trial. So making sure that you're not taking both of those at the same time will be important, or if you have any concerns about any other medical conditions that you might be having. But those are things that would set up a really good conversation to avoid problems down the road if we didn't know what those were. The most common side effects that patients can experience when they get Xofigo, because I mentioned that it's this radium can be absorbed by the bone marrow as well as the GI tract. Then this is where some patients can have problems with nausea or diarrhea or vomiting. And so dehydration might be a concern because of those. There can be some swelling of the arms and legs as well. And then we're always going to be monitoring for your low blood counts. So it will be really important just to bring those up to your provider if you were to receive Xofigo and have any of those types of side effects, so they can help manage them and make them a lot easier to tolerate as you go through therapy, if this became an option for you. So make sure that, because you're going to have your blood counts monitored, that makes the reason why keeping those appointments are really important. Our schedules are always busy. And sometimes we just want to say, oh, I can't make it to the doctor today, but those blood cell counts, those monitoring appointments, those lab appointments will be really important. Drinking plenty of fluid is something we always teach patients because of some of the GI effects. That would be things that you might experience, like dry mouth, or you're thirsty all the time, or it would give us an indication there's something wrong with your kidneys, meaning that you have decreased urine output, or your urine is concentrated, or there's any type of burning when there's urination, might give us an idea of the dehydration as well. And there's no restrictions, like I mentioned, around personal contact with other people after receiving Xofigo. We do have some cautions that we have about people who are handling the fluids, such as urine or feces or vomit, if you're taking Xofigo, and that might entail wearing gloves and certainly washing your hands as a precaution, and following some really good hygiene practices, which I'll get into in a minute, if there are any types of spills. And you would do that for at least 1 week following the injection of Xofigo. So Kelly, do you have anything else to add, safety, or what you've experienced?
No, I think that was a nice comprehensive list, and absolutely, I think that's because it's a radiopharmaceutical. I know, Robin, we can't stress enough that you are not radioactive after your treatment, that you can hug your loved ones, and that there aren't any precautions around that. And we will be talking about the precautions that we do have. Some kind of toileting precautions for up to the first week is really where that lies. But hugging your loved one, sleeping in the same bed, allowing your grandchildren to sit on your lap is all okay. And I know that can be a point of apprehension for a lot of patients. So I'm going to jump into this little section here before giving it back to Robin. And we're going to be talking about before, during, and after treatment with Xofigo. And so before each treatment, it's kind of nice to know what to expect, because that can be helpful with getting prepared for it. And so as we were talking, blood counts and monitoring blood counts to make sure that you guys aren't experiencing any cytopenias if you would become a candidate for this agent is really important. And so you will get a blood test so your doctor can be sure your blood counts are normal. And so oftentimes blood testing is required at baseline, so prior to the start of your treatment, as well as prior to each subsequent treatment. And so there's going to be a total of 6 treatments or 6 injections is the full course of the Xofigo treatment. So you would get lab work starting off and then prior to each of those 6 treatments or prior to the injection. I will say typically lab work is done about a week prior to each injection, just so that if they see that the blood counts, if they would happen to be a little bit on the lower side, then you're still able to get transfused if necessary, and that's completely okay to do, whether it be a platelet count transfusion or whether it be some packed red blood cells for your blood counts being a little low or your hemoglobin being a little low. But you're able to get transfused and still stay on track with the treatments. And your physicians know all the different thresholds of where those lab values should be and when it's appropriate to transfuse you and bring it up a little bit prior to the next treatment. Also, in regards to weights, this is a weight-based medicine. And so it is important that the providers, and they are aware of this, make sure that they have accurate weights kind of at baseline, because that's how you're going to be dosed, as well as prior to each treatment. If your weight fluctuates, that actually will cause a fluctuation in the dose as well. So that's really important to know that we're going to get some accurate weights as well with the lab work. So on the day of the treatment, this is an IV injection. So it's a 1-minute push that that your providers are going to be giving to you in the vein. So just as you may go in and have an IV placed for treatment, this is exactly what happened. They would place an IV when you would get into the facility. They would push the Xofigo over 1 minute in the vein. And then afterwards, they disconnect you. They flush it through a little bit. They disconnect you. And they'll take the IV out and you'll be able to go home. Some facilities may keep you just for about 15 minutes afterwards, but it is going to be based on their protocols and procedures at each individual facility. It is going to be, the injections are every 4 weeks. So that's an every 4-week cycle for a total of 6 injections. And so I think that's really important to know. They say if for some reason they can't get your blood counts back up at that 4-week mark, they do have wiggle room to push it out, get those back up, and then be able to continue giving you your injection. So I will say, when we were talking about the clinical trial, that overall survival benefit that Robin was telling you all about, that 3.6 months kind of median or average, that happens when you get all 6 injections. So we can't stress the importance of all 6 of those injections to be able to get that overall survival benefit. And then we're going to continue with after each treatment as well. So once the injection is finished, you can leave the office and go about your daily activities. And we were talking about that. And then you see this nice picture. You can hug your loved ones. Again, Robin and I already talked about that too. And then while you're being treated with Xofigo, you will continue to see your doctor who manages your cancer treatment. This way, he or she can keep track of your progress. I think it's important to note, so oftentimes Xofigo is referred, and so it will be either your urologist or medical oncologist that will say, hey, listen, I think you'd be a good candidate for this medication, and they will refer you and also work together in a multidisciplinary approach with radiation oncology or nuclear medicine. So it can be given in either of those places, or sometimes those particular individuals will come to the urology office or come to the medical oncology office to give the injections. Every facility is a little different, so it is important to kind of understand how your facility in particular works in regards to the referrals and where you're going to be getting the treatment. Also, with that being said, it's important to know who's going to be following up if you should be experiencing symptoms after the treatment. And so we're going to so whether it's urology that wants you to call their office, medical oncology, if they want you to call their office. I mean, there are a couple different providers that will be in the mix whenever they're giving you the Xofigo treatments. And so knowing who to call is really important up front. And that's a pretty simple question that you can ask while you're there, and then can also help prevent some headaches down the road. So hopefully that little extra tip is helpful for you. Also, be sure to tell your doctor or your nurse if you're having signs of low blood cell counts. And these are different things here, and I'm sure that you guys may be pretty familiar with them in general. But this is more bleeding or bruising than usual. So we're looking to see for thrombocytopenias, as well as catching more colds, fevers, at risk of infection, feeling short of breath, or feeling extra tired. So oftentimes the shortness of breath, the tiredness, if it's your blood cell counts, sometimes your red blood cell counts, in particular, your hemoglobin is what we're looking at that in your lab work. You can see a little paler in the face, and you're going to feel like you're not able to do everything you normally were able to do. So there's certain little things and keys that we use as providers to really hone us in on different things that may be going on in the lab work. All right, Robin, I'll pass this back to you. And if is there anything you'd like to add on that? Sorry, you're on mute still.
Thank you for the reminder. No, I didn't have anything to add. I thought that was really good. One of the things, there are some additional things that I touched on briefly just a moment ago was because your body removes radioactivity mostly through feces, the bathroom hygiene is really going to be important. So washing your hand well every time you go to the bathroom, flushing the toilet. We would do teaching with you to make sure that you flush the toilet 2 or more times after each use. Making sure that any bodily waste that is spilled would be removed completely or quickly. And your caregiver would probably even help you with that, wearing one-use gloves, gowns, if that was provided, and dispose of any of those articles as directed by your physician. It's possible that some of the clothing might get soiled. And so then that's just taking it and washing it by itself right away. So it's not something you have to throw away. You don't have anything disposable. It's just something you would just wash by yourself, by itself in the laundry, and just keeping the bathroom area clean. And you can have sex while on Xofigo. It's just making sure that good contraception is being utilized during treatment and following, and making sure drinking enough fluids. And one thing I'll mention about the fluids is, I grew up with older men who drank a lot of coffee, and that's where they got a lot of their hydration. They didn't go around drinking 8 to 10 glasses of water every day, and you'd see them with coffee in their hands all the time. And one of the things I'll mention about coffee, it has caffeine in it, which is also dehydrating. So it's going to be really important when we talk about drinking fluids. It's other things besides caffeine drinks, whether that's colas or sodas or coffee. And so that's just going to be something that you just have to find other things that you like to drink that keep you pretty hydrated during the day. So Kelly, is there anything that you've shared with your patients that's been helpful?
No, I love that point about the caffeine. I will say I have had patients, and I always like to dig a little deeper in regards to what kind of fluids patients are drinking, because some people they agree that just without realizing the caffeine's in there, and that is actually dehydrating and not helping with the hydration status, or alcohol is dehydrating, that's not helpful, and some different types of teas as well. So just in making sure that you have water, concentrated fluids, different things that you're mixing in there to help with that hydration status will definitely help mitigate symptoms in regards to potential side effects for Xofigo. So I have seen that be very helpful. One other point I did want to add, and Xofigo, it is an alpha particle emitter, and we were talking about kind of the short range of really of impact of where, it impacts the bone met, but really the spread, and really with that short range too, we always will equate it to that it can't even go through a piece of paper. And so whenever we're also talking about different additional considerations, gloves, if you're concerned, it won't go through plastic. So the alpha particles, and really it's up until that 1 week after the treatment is where is really that length of time that we think it's important for the precautions to be taken. And then after that, you can kind of go back to your normal daily grind, if you will. And then it's really just being universal precautions, using gloves, good hand hygiene, kind of for those 7 days. So, Robin, anything there? I just like that piece of paper. I think it's important because alpha particle emitters are definitely different than beta particle emitters, and as well as gamma. And this has about 95.3% of the product is alpha. And so treatment and support. So it's really important to know that there's definitely treatment and support options for you whenever receiving Xofigo. And so we have Xofigo Access Services. It's been around for a long time. Our FDA approval was back in 2013. So Xofigo had its 8th birthday, actually. So it's been out on the market for about 8 years. And Xofigo Access Services is multifaceted. There's it helps you pay for Xofigo if you do qualify. It's able to find assistance if needed with funding, grant funding, as well as offering $0 copays for commercially insured patients. And this is actually where the providers go through to order the medication as well. So they have a bunch of different avenues to help if needed. Our goal is to get patients product and drug to be able to help treat their prostate cancer. And so that is the main goal of Xofigo Access Services, that they're working to try to get patients drug that they need. If you are uninsured or underinsured, there are programs if you qualify for free drug as well. So it is important to note, regardless of the circumstance that you may be under, that there's it truly is just a phone call away. They can help to divvy out what bucket you may fall in, how they can help you. Then support. I mean, this is one of the most key things. We're on here talking with prostate PCEC, the Prostate Conditions Educational Council, and you can see them on the list as well. This battle is not fought alone. It's patients, caregiver support organizations are really imperative within this whole journey, prostate cancer journey, to be able to advocate for yourselves, to be able to advocate for others, to educate yourselves. And this is one of the key things, and I applaud you all for doing this. And so just knowing that there's a lot of other organizations out there as well to help to support you along the way, and it's not one versus the other. It is, you can kind of utilize as many resources as necessary to help you in this journey. Now, Robin, I'll bounce this back to you to close us out.
Yeah. So I think the one thing is that when, patients have metastatic disease, particularly to the bone, when it's not spread anywhere else, but even just metastatic disease in general, it can bring a lot of anxiety, a lot of concerns about how long a life can be lived, what's my quality of life going to be, and what treatment options are out there. And that's one of the things that's really exploded in prostate cancer over the last 10 years is just all the different options that are available. And just know that Xofigo is one of those options that potentially could make that life longer, where extended life more than 30%. And the way it works is that because cancer goes to the bone, so does Xofigo, and that's really how it works. It's really good at destroying tumor cells in the bone, and it also is a treatment that has a lot of support around it that we offer through Bayer that can really help you take advantage potentially of this type of treatment should that become an option for you. So. Anything else, Kelly, that you had?
No, I just wanted to say thank everybody so much for joining us this evening. And one more thing too, in regards to Xofigo, I don't want to forget to let you know this. Say you're on your ADT agent, so your Lupron, your Eligard, your Firmagon, you would continue on those agents, as well as any bone strengthening agents. So denosumab. So if you're on those with your provider, you would stay on those. Ones that would be stopped, like Robin was stating earlier, would be that Zytiga that would be held, or and then you would go on Xofigo. And if your provider and you decide to go back on a second generation anti-androgen agent afterwards, then at that point that would be reintroduced. But so I think it's important that you are going to stay on some of those medications. You're not going off of everything. Then after you're done with those 6 treatments, you're going to talk to your provider about what treatment option it is going to be best for you next, if you will. So, but thank you again.